you have to rinse their mouth and get their organic debris out. So make sure you have something to do that well. We kind of left that out, but a good dosing syringe is very, very handy. And make sure your patient is comfortable. If that horse is fighting you and you're frustrated, you're not going to you're not going to perform a really nice exam for that horse. And furthermore, explain to the client what you're doing. When you're in there with that mirror looking around, they don't know what you're doing. And I think showing them and getting them involved and telling them why it is so important, because like I said, I tell clients all the time, I don't care their horses get sharp points. I really do. I mean, we provide comfort for them in performance and so that they don't get horrible malocclusions and everything else. But, you know, I extract 5 to 8 teeth a week out of horses' cheek teeth because they're dead. And a lot of times those horses have been floated numerous times before they show up at our door. And that tooth deserved to be known that it was dying as soon as it happens. And that's where your mouth mirror comes in this component exam, so that you're checking boxes so that you don't miss something.
And one of the advantages, I guess, I've found over my career is the horses or the patients that you get to see regularly overall have less disease because you're getting in there, making the appropriate diagnosis and giving the appropriate treatment. And over time, as a group, these horses have far less periodontic and endodontic disease compared to the population that doesn't have any dental care. I do want to just quickly circle back around and just have a chat about excursion to molar contact and lateral excursion.
Yeah, and that's very important when you're talking about the functional mastication of the horse. And, it's been said that about one tooth is normal from a side to side lateral excursion. So when you move the mandible to the side, they have a table angle that's formed because they're an anesiognathic species. So as we move the mandible, say, to the horse's left, we're going to see the incisors open. And so that's a very important thing to check when you're starting and finishing, that if you have a horse that you're worried about maybe not being able to chew well and masticate properly, and his incisors you think may be too long because he's an older horse and he's not grazed much and wore those incisors, you may want to do a bit of an occlusal adjustment on the incisors as well. But this goes into a little bit more of functional mastication and occlusal adjustment. But what I tend to use is, when you look in that mouth, you're going to get a very good view, hopefully with a bright light, on what their table angles are from one side to the other, and they should be very similar. If they're not, there's something going on. The other thing is, I said I really get into color. If you open a mouth in one quadrant, two of the quadrants of teeth, so 100 and 400, are stained very badly on the occlusal surface only, and the opposite 300 and 200 quadrants are not stained at all and they're that nice yellow, I can start to assume that that horse is not chewing well on one side, because he's staining the teeth and he's not scrubbing hard to masticate against that. And that usually tells me that I've got a sore tooth somewhere in there, or pain and inflammation. Calculus will build up in areas where they're not chewing well also. So look for an increased amount of plaque and calculus on teeth.